Hello everyone, my name is Connor Franklin, and I am going to be teaching you a little bit about adolescents and STDs and STIs. So, to start off, I'm going to do a little overview of current data and trends in regards to STDs and STIs in adolescents. First off, I have some data here from the CDC and a few other sources. In 2015, the CDC did a survey of U.S. high school students, and it found that 41% of U.S. high school students had had sexual intercourse. 30% of U.S. high school students had had sexual intercourse within the last 3 months. Of those who had had intercourse within the last 3 months, they broke that data down a little further. 43% of them did not use a condom, 14% used no birth control whatsoever, and 21% said there was alcohol or drug involvement. With STDs and STIs in the United States, people aged 15 to 24 account for half of new STDs, roughly, each year, while they only represent about 25% of the sexually active population. So that basically means that adolescents and young adults are more prone to getting STDs than those who are in other age groups. So there are also higher incidences of STDs and STIs in other populations. Some of the things the CDC listed were African Americans have higher incidences, females have more incidences of STDs and STIs than males. Those who were abused as youth have higher incidences, so do homeless, men who have sex with men, bisexual women, transgendered individuals, and those who are living in poverty. So, some other things to know. The reasons that adolescents are at higher STD risk, there's a few, but some of the main ones are there is a tendency towards short-term sequential partnership, so many partners in a row in a short period of time. That's a little more common with adolescents than with older adults. There are also obstacles to healthcare access, so either the adolescents don't know what healthcare access they have, or they're worried about their parents knowing whether they're having sex or not, or they just don't have health insurance. There are a number of obstacles there. They're also less likely to use condoms. That's just a statistic that is a fact, unfortunately. They're also, due to everything that's going on with their body during adolescence, they're more susceptible to STDs and STIs, just biologically. Another thing to know as a teacher is that minors are allowed to consent for their own healthcare services related to STDs. That is legal. Again, women are more susceptible to males to STDs and STIs just due to the anatomy, although they're less likely to be detected in women. Again, anatomy. Dating violence and sexual assault victims are less likely to use condoms than those who have not gone through such an experience, and certain cultural and religious backgrounds discourage usage of condoms or other birth control methods. So that's another thing that's important to know. So, as teachers, what can we do to help with this issue? So, there's a few tips we have here. So, one is just kind of common sense. Know your students. So those who are troubled, those whose behavior changes rapidly or uncharacteristically, things like that, they're more likely to partake in risky sexual behaviors. Those things are often indicators that something is going on in their life. And it's just good to be able to know your students and connect with them, so when something is a little off, you can kind of tell and dig into that a little further. It's also good to know, as a teacher, that schools can provide free confidential STD testing. Some schools have this, some don't, and if your school that you end up working at does not have it, please try and encourage the school to do that. It's something that's not that hard to implement. It's expensive, but it's not that expensive, and it can do wonders for the sexual health of the students. And also just do your best to educate, in whatever way you can, your students about the support they have, the resources they have. So not only is there the school nurse and school counselors, but most towns and cities have free clinics of some sort, or other ways that students can get advice, help, etc. to try and prevent STDs and STIs. Then I just have my list of references, and that is the end of the presentation. Thank you.